Hi, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry, and today I'm going to talk a little bit about some very common dental procedures. So here we go. First, let's answer the question, what is a filling? So a filling is one of the most simple and basic dental procedures. In situations where a tooth has a cavity, which means the tooth has rotted out and now it's soft and mushy, we first get the patient numb so they don't feel anything, and then we go and drill out the decayed, mushy tooth structure. Once we've gotten it all cleaned out and your tooth is left with nice, clean tooth structure, solid tooth structure, we put in this putty-like material, which is what is called a composite resin filling. We pack it into the tooth, we smooth it up, we make it the same shape as the tooth, and then we put a blue light on it. The blue light hardens it and puts it in its final state. Then we smooth it up and check your bite and make sure you're not hitting too heavy on it. Fillings can also sometimes be done if you have a small chip on your tooth. But those are the most common reasons and situations where you would get a filling, and that's what a filling is. So, question number 2, what is a crown? A crown is essentially an outer covering that goes over your tooth and covers it and protects it. Crowns are indicated for situations when a tooth is very weak or compromised. For example, if your tooth has had a root canal and has been hollowed out, or if a big chunk of your tooth has broken off, or if your tooth has a crack in it. These are all very common scenarios where you have crowns done. Once again, we get the patient nice and numb, then we go and we shave the tooth down all around and on top to make enough room for the crown, and we take a model of your tooth and we put a temporary crown on there. Then you come back 2-3 weeks later and a lab has custom made a nice permanent crown for you, and we try it on, make sure it fits well, and we glue it on there. Usually the second visit is only 30 minutes and does not make you have any pain, so it's a simple procedure and we don't need to get you numb for that second visit. All right, so let's answer the question, what is a root canal? A root canal usually gets a bad rap and people are quite scared of it, but nowadays root canals are not too painful. Long story short, if the nerve of your tooth has a problem, meaning your tooth is hurting a lot or your nerve has become infected, then a root canal is indicated. This is where we go and we once again get you nice and comfortable and numb. We drill a hole into the tooth, we go in there and we clean the nerve out of your tooth, and we fill it up with this inert plastic-like material. So afterwards, your tooth no longer has a nerve, which is a good thing because that means you can no longer feel any pain on the tooth. Once again, as a result of a root canal, a tooth is hollowed out and is much weaker, and usually a crown is indicated after you've had a root canal. So that's a rundown of some very common dental procedures. Thanks for checking out this video, and if you're looking for a wonderful dental practice here in the metro Atlanta area, then please check out our online reviews and you'll learn that we've got a very special dental practice here at Brookhaven Family Dentistry.